we say, let's be honest, our infection control in our hospitals only work as fast action, such as running to solve an outbreak. And we encourage people to take action when we have a problem. But when the problem settled, people go back to their bad way of practice. And studies prove that in 2 months' time, after the problem is settled, healthcare workers will go back to their hibernation. So let me wonder again, is it the type of continuous education we give to our staff, or maybe it's the lack of teaching infection prevention and control in academic curriculum for healthcare workers, nurses, doctors, or even other specialties like other allied sciences who work in the hospital. Yeah, there is few facts that we need to admit as people who specialize in infection control. There is a shortage of qualified and highly skilled educators, or let's say specialized in the field of infection control. And this scarcity can limit the availability of experts who can effectively teach and guide healthcare workers in proper infection control practices. The other fact is that knowledge provided in hospitals regarding infection control may not be effectively translating into practical application by staff member. And this may indicate that there is a potential gaps between the understanding and compliance. In addition to that, the inadequate hospital infrastructure in many third world countries or limited resources countries, which hinders the improvement of infection control services. Lack proper facilities such as isolation rooms or separate areas for different patient population will increase the risk of cross-contamination. Additionally, shortage of necessary medical equipment further increases the challenges in maintaining effective infection control measures. Healthcare workers in general may not be effectively retain the required knowledge after traditional lectures. The repetitive nature of these conventional approaches often leads to disengagement and reduced motivation to learn and implementing some of the good and practicing techniques. So innovation and interactive educational strategies, maybe we think that we need to think about to create more dynamic learning experience and increasing staff retention of some vital infection control information. Next slide, please. This actually, what I've just said, can be confirmed by looking to this learning pyramid, where you can see there's our hospitals. In our hospitals, most of our ways of education is actually lectures. The retention of acquired knowledge is about 5% of the lectures. So, and that might be actually in the people who are really interested, people who are forced to come to attend these lectures. Maybe they're not interested, so they will lose that interest. And the people who are really interested will just retain around 5% of that knowledge. And the rest of them maybe just enter the lecture and leave without anything really remained with them. And maybe within a few hours will forget what they were actually taught. Next slide, please. So if we take a flashback about COVID and all the confusion, what was happening at the beginning, we can remember that we had a lot of confusion in the beginning of the outbreak, like isolate or not to isolate. That was the question at that time. Using PPE, which act as a barrier against potentially infectious material that not only protect healthcare workers, but also helps contain the spread of different infectious diseases, ensuring safer healthcare environment for all. We had also a problem in that, and at the beginning, we didn't know, shall we use N95, shall we use surgical masks? Some people doubled the masking. So all that happened as a chaos because it happened suddenly, and we had to be prepared without good preparation in the first place to deal with such an outbreak. Next slide, please. So the challenges that we actually face, these challenges, it's not only in local hospitals or in particular countries than others, These challenges actually happening in many studies also identified with the same conclusion, where they found that around 63% of their hospital staff have compliance gaps in hand hygiene, which confirm that inadequate hand cleaning. And the other challenge is actually the PPE, where around 51% of healthcare facility know that their staff don't use PPE as properly as they should be. And I'm sure that we all in our hospitals have similar situations. Next slide. So, what are the possible solutions? First of all, we have to determine the appropriate training methods, which mean that we need to know what is the possible new training methods for healthcare workers in hospitals. We need innovative techniques such as simulation-based training and virtual reality, provide hands-on experiences and realistic scenarios for better comprehension and retention of important infection control protocols. These modern approaches will empower healthcare workers to enhance their skills and effectively combat the spread of infections in hospital settings. We need to overcome the language and cultural barriers. We know that we have different staff from different countries, and of course, they all have different backgrounds, schools. They're coming from different natures, different grades. So providing translated materials, utilizing multilingual staff, and offering cultural sensitivity training can help bridge communication gaps and ensure accurate understanding of infection control practicing. By embracing, by embracing diversity and actively addressing language and cultural differences, healthcare workers can effectively engage with patient and staff and take the knowledge from infection control trained staff in order to improve the services in the place. Also, we have to ensure that there is access to resources, and this can be achieved by providing adequate funding for necessary equipment, supplies, and training materials. Additionally, establishing efficient distribution system and regular updates on best practices that can guarantee that healthcare workers have the tools and knowledge needed to effectively reach these sources. Then we have to monitor and evaluate what we actually teach and give to the staff. Regular assessment and feedback mechanism can help identify areas of improvement and provide further guidance as needed. Finally, sustainability. This is very important thing that can be achieved by implementing reinforcement strategies such as regular refresher courses, ongoing mentorship, providing access to updated resources of guidelines. These are very important, but we do have to think about that and think about also what we can put as improvement solution in a short term and long term. So next slide, please. So in short term, we have to think about things which we have in our hands now, like using e-learning, which is proved its ability to increase and sustain a knowledge in infection control. We also need to use other type of education resources which are not used commonly, like video, scenario-based visual cases, and also quizzes, and some games also will help to break that traditional way that we usually give knowledge with. The need of different time arrangement in our institutions. We all know that in most hospitals, they use one of the days, like for example, every Tuesday morning, they have an educational session, and some surgeon who usually have their busy schedule at that day in Tuesday, so they can never ever attend that day educational activities. So what we need to rotate the dates. We have to change the days so where staff can attend during Sunday, during Tuesday. So these have the chances to actually, whoever that miss activities can actually come and join the activities. We also need more comprehensive educational programs that actually will teach the staff more in-depth knowledge of infection control. Next slide. So in order to empower education in infection control to overcome the challenges, we have to have a long-term method as well, which that can sustain the improvement and keep it going for the next generations. First of all, we have to add infection control in undergraduate curriculums to all healthcare workers' specialties. We have to focus on the practical and necessary skills practices. We have also to continue top up our education, our continuous education. And of course, we have to use, as I said, different type of educational tools. And finally, we have to assess the gained knowledge. It's very important that make sure that the staff have that knowledge that they can keep them going. So next slide. So to summarize everything together in a way that we have to look to the future, which can empower the education in infection control, we have to agree that using new technologies and learning platforms such as virtual reality and stimulation-based training is very important and very helpful in actually keep the staff interested in infection control, and they can be engaged. E-learning platforms and mobile application for convenient access to educational materials. We don't have to call the staff to attend on site. They can attend and review and get their exams or do all the learning through their mobiles or through their computers. We have to personalize our learning experience, which means we have to adapt the learning system to tolerate it to our individual needs and knowledge gaps. We didn't have just to take any certification program or any way that other big hospitals did it in different way in different places around the world and just paste it in our program. We need to adapt it. We need to tolerate it. We need to customize it in order to be really practical. We have to have enhanced collaboration by networking with different online platforms for sharing knowledge among professionals. So I work in a hospital and other colleague work in other hospital. We can share knowledge, we can share information, we can actually have all the learning process open to everyone. We have to incorporate artificial intelligence programs for automated system, for real-time surveillance and tracking of infectious disease, and also not only tracking the infectious disease, also to spread the knowledge. And finally, we have to address the barriers to implementation and accessibility of infection control education to bridge the educational gaps in resources limited settings. Next slide. So in conclusion, training in infection control as a practice should start from the junior academic years and increase upon seniority by continuous education. Continuous education in clinical years should be formatted with the involvement of specialized people in the subject who have the real life practice and qualifications. We can't give teaching infection control to unspecialized people. And continuous education should include traditional and non-traditional ways of teaching, as just mentioned. Tolerated learning system that meet individual needs are prepared to reinforce engagement and sustain the knowledge retention because it's made for your own institution. It's not something taken from outside, from anywhere without tolerating it and customize it to your needs. Finally, AI. AI proved that it's very strong, that we can use, can aid in the development and modification of infection prevention strategies and guide the development of evidence-based protocols. Next slide, Qasim. So these are the references, and you will have the slides so you can take a look on the references for people who want to actually expand their knowledge about this topic. Stop here and thank you very much.